Good. Well, depending on your time zone, good morning and good afternoon. We're here for a wonderful discussion of governance during the COVID-19 pandemic. Um, I'm Larry Gostin. I'm the professor of global health law at Georgetown University and also director of the World Health Organization Collaborating Center on national and global health law. I'm really very pleased to be able to moderate this session. Now let me uh, try to frame our conversations and then introduce a really splendid panel. Uh, I think, ever since, late December, early January, really, of December 2019 and not till January 2020, when a report of a novel outbreak occurred in the city of Wuhan, and then within weeks and the following, just literally a month, it swept like a tsunami. The virus that we now know, SARS-CoV-2, from Wuhan through to Hubei province, mainland China, all through East and Southeast Asia, to Europe, the United States. And as we know now, it's marched relentlessly across the globe, created really concerning variants, including the Delta variant, which is gaining predominance in many parts of the world. And while in some parts of the world, there's been relatively high vaccination rates in Europe, the UK, US, and other places, we have to remember that the global vaccination campaign and the global COVID response has been, I don't know, how shall we say, abysmal failure, certainly quite inequitable, as we see the virus raging in various parts of the world. So we're going to talk about, the governance of the COVID response, and try to look at it from, legal, ethical, and policy frame. And in some ways, COVID-19 has brought out the worst in us, and in some ways it's brought out the best in our governance. Certainly we can categorize so many governance failures at the national level, particularly with the advent of nationalistic populism, with governments around the world really being very self-interested, but that's true even beyond nationalist populist governments, as Suri will say in her remarks. But it's also meant, a denial of science, which we're seeing now with vaccine hesitancy, undermining public health agencies, making simple public health tools like masking or distancing as political, and now we see that playing out in vaccines. And paradoxically, I've worked with the Global Health Security Index, which had ranked all countries around the world in terms of their health system preparedness. Many of the countries with the most robust health systems, did quite badly. I have in mind, the UK, the US, the European Union. So there was something about the governance at the national level. At the international level, I think WHO has behaved quite heroically, but it's been caught in the middle of a political storm, particularly between the East and the West, between China and the United States. And we're still seeing that play out, at the G7 summit in the UK and the European Union summit that recently took place. So, I could go on and categorize, many more of our response and governance failures, both at the national and international level. But there are also just remarkable examples of good governance in soft and hard ways. I mean, the fact that we have seen poor political cooperation and solidarity, but wonderful scientific cooperation and science and solidarity has been, quite remarkable to see. We've developed the vaccine in record time, in under a year, where the very quickest we were ever before was 4 years with mumps. And so the science has been as breathtaking as Mother Nature has been in terms of developing this wily pathogen that we know as the SARS-CoV-2. We've also gotten new forms of institutional response mechanisms, which have not worked perfectly, of course not, and they have many governance failures that I think that we're going to be talking about in today's seminar. But nonetheless, they are, in my mind, breathtaking for their audacity and what they were trying to achieve and still could achieve, I think, with political will and a change of governance. Things like the WHO's ACT Accelerator, COVAX being the vaccine arm of the ACT Accelerator in partnerships with Gavi and CEPI, along with WHO, being the two most notable. While the G7 was and the UN have been pretty stodgy, we did see some movement in the G7, donating 100 billion doses, far too little. We've also seen stagnations at the World Trade Organization in terms of IP waivers, with almost a split even in the West between the EU and the Biden administration on whether they support or not an IP waiver. So these are the kinds of things that we're going to talk about today. We're going to start with Professor Yeoh, who's a professor of public health and director of the Center for Health Systems and Policy Research at the Jockey Club School of Public Health and Primary Care at Chinese University of Hong Kong. He directed the school from 2014 to 2020, and his research is, world-renowned in health systems, services, and policy, and applying systems thinking and studying how complex components of health systems interact and interrelate to improve health. He's a principal investigator in 2 major commission studies now, and he's led the COVID-19 Global Research Roadmap Health Systems Impact Subgroup study, a government response measure in 6 middle high-income jurisdictions in the Western Pacific region. He will be followed by Professor Suri Moon, who's co-director of the Global Health Center and professor of practice, interdisciplinary programs and international relations and political science at the Graduate Institute of Geneva. Suri and I go back a long way. Her work is breathtaking in its scope and articulateness at the intersection of global governance and public health. And she's had specialized policy and expertise in how to achieve more globally equitable innovation and access to medicines and strengthen global health governance. She also directs the Knowledge Network on Innovation and Access to Medicines. Dr. Mark Eccleston Turner, also who I've worked very, very closely with, is a lecturer in law at Keele University. His research specialism is in the field of international law and infectious diseases. And he's been a particularly astute commentator, scholar, and leader in pandemic influenza preparedness and access to vaccines and the law of international organizations. and he's published extensively. He's advised the UK Foreign and Commonwealth Office and the Department of International Development. And he's a member of the UK Parliament COVID-19 Outbreak Expert Database. So with that, why don't I turn it over to you, EK, to get us off, and then Suri and Mark, and then we'll have an interactive conversation. And remember to post your questions on the Q&A.
Okay, thank you very much, Gostin. I'll cover mainly the national responses because the work that I've been doing, and then also talk about some of the implications on the global and regional level. Because we have been studying the countries in the Western Pacific region, which were the earliest affected by COVID, and in the countries where the jurisdictions where we had experience with SARS and MERS, obviously government response was very prompt. So Hong Kong, Singapore, we were right during SARS. We were very heavily affected, and then Japan and Korea was affected by MERS. So they were able to scale up the responses very quickly. So I think in the immediate response to COVID, I think these jurisdictions did very well. And what we also saw, in the global community, the other parties, the other stakeholders, the other governments partners, especially the civil society, also responded very quickly because the government was so busy trying to contain COVID as the epidemic erupted. The NGOs and the foundations, a lot of charitable organizations, really were there to fill the gaps because a lot of the services were not functioning as one would expect, and many things were just diverted to COVID. So I think those were the good things that happened. But of course, as the pandemic escalated and became so rampant, the measures that were taken became quite disproportionate. And the impact of the measures were really to the most vulnerable. So when we had a lot of these physical distancing measures, people were asked to stay at home. Of course, in many countries, the most vulnerable people stay in very poor conditions where infections occur. So when you look at the epidemiology of COVID, 80% of all infections occur in the home. So when you ask people to stay at home and your home environment is poor, then it's really the people who are low-income people, people in compromised socioeconomic positions are going to suffer. And of course, then the mitigation measures were also not very well targeted. Now, I think that the measures that were done as the epidemic evolved really took the lower socioeconomic and the vulnerable populations took the brunt of the impact. And of course, this was not factored in. And many of the things that were done in terms of the restrictions would never have been tolerated if there was no pandemic. And the restrictions, particularly on people who had to stay at home and did not have any social support, because many of the kids could not go to school. So many of the low-income families really had problems in terms of providing childcare. But some in many places, like in Hong Kong, the business continued. The business will never close, but people were encouraged to work from home. So a lot of the impact on the population and the measures that were taken did not really consider the problems that would have impact on people on the losses on the more vulnerable populations. Of course, also in many parts of Asia, we had a lot of migrant workers, and like in Singapore and in Malaysia, many of the outbreaks occurred in factories where migrant workers were working. So they took a lot of the brunt of COVID. So there were a lot of problems in terms of the involvement of as the pandemic evolved, we saw a lot of weaknesses in the government systems because the involvement of civil society, involvement of businesses was inadequate. So many of these things were after the fact. So when you looked at, even when you try to lift restrictions in Hong Kong and in many parts of Asia, when you try to lift the restrictions, government really didn't prepare for it very well. and they didn't engage businesses or civil society sufficiently to see what needed to be done. And of course, government was responding in terms of from the prudence angle, and many of the measures really were not proportionate to the risk in many parts of the country. Of course, then you have an ongoing problem. So I think one of the things that I see from this is that this is a good opportunity for us to really look in terms of since people are aware of the problems and are still prepared to see how we can prevent future problems. So to strike when the iron is hot, and then to see how we can build better preparedness plans where civil society and businesses are part of the process. Because many of the preparedness plans that we had in the past had no involvement of anyone else other than people in public health and in public policy, with no understanding of the problems of some of the measures that we're taking on civil society. So I guess if we have better preparedness plans, governments are better prepared, the contingencies are better built, how do we build the resilience, then there'll be fewer problems in terms of pressures on government to be more nationalistic and be able to share some resources. The other thing I saw was, I think that some of the regional governance systems seemed at least to try to fill some of the gaps, like in the European region, although there were some problems, but they were certainly, that's an area like where maybe some attention should be paid to, because I wasn't aware that the Western Pacific Regional Office, I didn't know the relationship between the regional offices and the WHO head office in Geneva, what the roles were. I think they could certainly play a much greater role in supporting the countries so they can coordinate some of the governance functions to support countries. Because if countries are able to tackle the problems, then they're more willing to share in terms of the resources. I'll stop there.
Thank you very much. I think, to me, the most important point you made, and it was such an obvious one, but I don't think any of us, thought of it very much, is that, public health officials should be, preparing, doing their preparedness plans and response plans in conjunction with civil society and with business communities. I think that's a really good way to, think about not just responding, but also in our next phase of preparedness for this pandemic and for the next. Okay, thank you very much, EK. Over to you, Suri.
Thanks so much, Larry, and also for the kind introduction. I'll try to be quite brief and just make two key points because I see some familiar names in the audience list and would love to have a chance to engage back and forth, both with the other panel members and the participants. So the two big ideas that I would like to leave you with really focus at the global level and looking at how ethical and equitable have outcomes been at the global level. And I think, Larry, you laid it out already very nicely. Things are far from that. And why is that? So I think the two key ideas are, one, that we've seen in this pandemic, this resurgence or reminder that at the end of the day, when push comes to shove, governments, states really act in their national self-interest. And I think for scholars of international relations, this is often a starting point. But what we don't often think about in IR is what does that mean for outcomes and how ethical are outcomes? And of course, when states act in their own interest, you're not necessarily likely to get ethical outcomes. You will have rule of the jungle in the sense of the most powerful will get their way. And I think that's basically what we've seen in COVID. I'll go into that in more detail, but I just wanted to put my second key takeaway on the table. And the second key point I'd like to leave you with is that if we want to strengthen global governance, if we want to fill the gaps or rebuild a system that has proven to be deeply inadequate in terms of global arrangements, for example, for cooperation, we have to do it by not forgetting that at the end of the day, particularly in crises, states will act in their own national self-interest. They will be selfish. And so I think that that has a lot of implications for how we approach post-COVID reforms. And if we want more equitable outcomes, if we want more ethical outcomes at the end of the day, we have to build rules and commitments around an assumption of self-interested behavior at the end of the day. And I think it's possible to do that, but perhaps not always obvious. So coming back to my first point, when we think about countries acting in their national self-interest, I mean, there was a little bit of variation. Some countries were a little bit more selfish or perhaps much more selfish than others. But at the end of the day, all governments really were thinking about what do I need to do to protect my own citizens? And that can lead to outcomes that perhaps are ethical at national level, but are deeply unethical and deeply inequitable at the global level. And the scramble for access to vaccines is really the clearest illustration of that. And I think we heard a great description, a summary of what the situation looks like from Larry. But if we look at, there's been a lot of emphasis on the fact that high income countries have hoarded and secured, the lion's share of global supply. This is true. We haven't spent as much time, at least here in the North, in the media, looking at how many lower middle and upper middle income countries have also been quite successful actually in securing access to vaccines for themselves. And those who've lost out and those who are furthest at the back of the line tend to be the poorest countries, the low-income countries. Obviously, this is not an ethical situation, but it does highlight that even lower and upper middle income countries are actually quite effective in pursuing their own interests in the global system. And so this is really just a way of reiterating this basic characteristic, I would say, of the international system. Now, if we accept that this is the way states have behaved and will behave, then we have to rethink what kinds of agreements we negotiate at the global level. That at the end of the day, we have to persuade governments to make commitments based on the idea that this will serve their own interests in the long run. What do I mean much more concretely? I've been speaking in broad generalities. So for example, there's many of the panels that have reviewed what's gone wrong in COVID at the global level have recommended more funding for WHO, but also less tied funding, less earmarked funding, more autonomy for WHO. Now, governments will only do that in the long run if they believe a more autonomous WHO is better for them. Not because WHO is a great organization, not because it's so important, not because we rely on it so much, but because autonomy for that organization in the long run is actually better for every single one of us and every single one of our countries. And I think this is perhaps a case that's not been made strongly enough. Similarly, when we look at the vaccine situation, I think we've been relying unfortunately too heavily on arguments that this is the right thing to do, that countries should share vaccines equitably. It's a charitable thing to do. We've been using primarily development aid to try to finance COVAX. And clearly this has all failed. And I think that at the end of the day, and of course there have been arguments made, about national self-interest, but clearly they've not been strong enough to, I think, change the minds of those who have the power to actually get vaccines out to people faster in order to make major changes. So what I'm trying to emphasize, and I'm just going to wrap up here, is that if we want to have more equitable responses to pandemics in the future, if we want more equitable access to vaccines, if we want a stronger WHO, we have to build global systems in such a way that every country, regardless of its leadership, will see that it's in their self-interest to comply with those rules and to cooperate internationally. And if there's one thing that I would say we've seen in COVID-19, it's that global governance did not work. Global governance broke in a way. It completely failed, and it really was not up to the task. And so I think we need to really go back to the drawing board and think about how do we craft rules that will be more politically durable in the future.
Thanks very much, Suri. That was really terrific. And, I think that is the great challenge for global governance going forward for this. The question is, how do we frame those self-interest arguments in ways that are acceptable? And the one thing that did occur to me that we need to kind of think hard about is that many government leaders, want short-term self-interest. In terms of longer term interest, national interest, they're less interested politically because they won't be facing elections then. And, in many ways, autonomous WHO, this is good for the long run. So we've got a long way to go, but that kind of solid observation that, countries, are going to act in their self-interest and always have and probably always will for the foreseeable future, brings us from the idealistic to something that we really need, can achieve some benefits toward. So thanks very much. We'll come back to all of that, and then, but first we'll hear from Mark, and then I'll remember to ask in your Q&A function, and I'll be putting your questions to the panelists.
Thank you so much, Larry. And I'm just going to spend a few moments just to build on what Suri was saying there about the international system, which is what I will focus on. I thought it was interesting that Suri said that this was global governance failing, whereas the cynic in me thinks that actually this is the global health governance system that we created working as we wanted it to, in that we have created a system which allows for this nationalistic self-interest to play out quite overtly. And I think that there's a few really good examples on this. When we look at the IHR, the sort of international governing framework for outbreaks, there is a huge, so despite the fact that the IHR are meant to be about detect, prevent, and respond to emergent disease, a huge emphasis on detection. There's a huge emphasis on health system strengthening to have the ability to detect health outbreaks when they occur. There's very little emphasis within the IHR itself on the response. Very few powers are conferred to WHO to coordinate an international response once a fake is declared. And the core capacities which are contained within the IHR are very much around alerts and around alerting to the rest of the world about what is about to happen to them, not about enabling a country which is concerned, particularly low and middle income countries where most emergent infectious disease originate, to actively and rapidly respond to the outbreak. And we've seen this across a number of outbreaks. The fact that during the West African Ebola outbreak, it took the Security Council to pass a resolution declaring this a threat to peace and security before the international response really ramped up into question, shows how little emphasis we actually have on response. There are a number of outbreaks where too little has been done too late leading up to COVID. And this is a characteristic of the system which we created, which places insignificant emphasis on response and far too much emphasis on warning the rest of the world. And I think that to build on the stuff about COVAX, I think that, looking back at 2009 during the H1N1 pandemic, it was very clear then that advanced purchase agreements would be used by a very small number of high-income countries to actively dominate the procurement of pandemic vaccines. We knew that that was the case during 2009. We saw it happening. We saw it unfold. And after 2009, we did very little to solve that problem. We created the PIP framework, which only works in a very, very limited, very specific way for a specific strand of influenza vaccines. We knew another pandemic would happen again in the future, a novel infectious disease outbreak. And we knew that our route out of that infectious disease outbreak would be vaccines. And we also knew that in that event occurring, a very small number of very wealthy countries would dominate vaccine access. And we did nothing to prepare for that moment. So we created COVAX and we created the ACT Accelerator in the middle of a pandemic. So it was always playing catch up. So whilst COVAX was being created, whilst there were meetings about how are we going to design COVAX, how are we going to fund it, countries like the UK, countries like the US were already signing their contracts. COVAX was always behind right from the very beginning, because in peacetime, to use security metaphors, we did very little to put the systems in place so that when we needed COVAX, when we needed the ACT Accelerator, when we needed a response to an outbreak, the systems would already be in place at that time. And that's one of the major problems, as I see it, is that actually the system has been far too designed to be about warning and being about detection, and very little emphasis on response. And we have not addressed the response failures which we knew would happen. I'll leave it there because I know we have some questions.
Thank you very much, Mark. I mean, I think, I think the point you've made is that the global response we've seen is the global response we deserve because we built it. And it's kind of pretty much Suri's point as well in terms of, we've always known that national interests were going to prevail. And we did see that play out in influenza H1N1. And we're actually seeing it play out even more now with vaccines, because as we, what we saw with H1N1, even with, President Obama, who was, an internationalist as Biden is, there were pledges made to share right at the beginning, but when countries were most concerned about their own epidemics, they didn't share. And once they had excess vaccine, they began to share. And that's what we're seeing now. The countries will share when it's easy for them to share, but they won't do it when it's hard politically. And so, we have a number of questions. Some of the questions are being put in the chat. So please, if you've put your question in the chat, move it to the Q&A section. What I'm going to do is just first start with some of the questions that we got before this seminar in anticipation of it. And one set of them we've talked a little bit about already, but what's new in terms of COVID governance and collaborations, and also in terms of what's new, like the ACT Accelerator, how could it have been designed better? And what's missing? Is there, transparency, accountability, inclusive governance? What are the kind of missing elements to it? So that's, a first set of questions. But the second set were also very closely related to what we've been talking about, and also to global governance in terms of the rise of bilateral agreements and how that is affected. What's been the role of non-state actors, and how do we balance competing interests? So why don't I start with on the global governance side with Suri and Mark, and then there's a specific question after that that I'd like to ask EK, because we want to really understand how the national response fits in. Suri, do you want to start?
I want to tackle the important question of what's new, what's different. And I think, building on what Mark was saying earlier, two really critical developments since 2009 are expanded vaccine development capacity and expanded vaccine production capacity. And responding to some of the comments that have come in on the Q&A and chat, of course, vaccines are not the only important technology or even the important intervention. I'm relying a lot on the example of vaccines because I think it tells us a lot about global governance, its failures, and hopefully some successes. But going back to what's new and why does it make a difference? So we see already that vaccines developed by China and Russia are widely deployed in many countries of the world, and many middle-income countries in particular are now relying on a mix of Western, Chinese, and Russian vaccines, and that's how they've managed to secure a significant supply, faster than if they had relied on charity or a global entity alone. And this is an important difference, I think, from 2009. We've also seen that production capacity is more geographically diverse than it was before, and it's not been enough, but certainly the heavy reliance on Indian production, I think soon to be heavy global reliance on Chinese production, remind us that, we live in a world where the balance of power is changing, and that you have both industrial and scientific capacity that is much more widely distributed. It's not so concentrated in a few rich countries as it was even 10, certainly 20, 30 years ago. And I think this is really important because when we think about how do we want to strengthen global governance in the future? This is the world we have to build new solutions in. We have to build new solutions in a world where you have the ability to develop and to manufacture not only vaccines, but other countermeasures, to develop non-pharmaceutical interventions, other public health strategies. You know, these capacities are really distributed around the world. And when we think about self-interest, going back to my earlier point, I do think that I don't think cooperation is impossible. I think cooperation works better when you have at least some self-interest on the table. And we see that the self-interest of a country is usually much more obvious at the regional level. So here I live in Switzerland, we're surrounded by 4 other countries. I can tell you it's very clear for Switzerland that their self-interest is very closely tied to the self-interest of the 4 neighboring countries. And I think this is not the only part of the world where that's true. What we have seen in this pandemic is strong capacity to cooperate beyond the nation state level in 2 regions where you have the political institutions to do that. That's Europe and Africa, the European Union and the African Union. In other parts of the world, we have not seen that. So all of this is to say, we should take advantage of the fact that what is new is this more globally distributed capacity to come up with ways of responding to pandemics. We should build regional institutions for cooperation and then find a way to make these coherent at the global level. And I think this is going to be a more effective way of moving forward than only big global solutions that all sit here in my adopted hometown of Geneva.
Yeah, thanks. I mean, there just a couple of remarks before I go to Mark. The interesting thing about all of these vaccines is that it's kind of a blessing and a curse. You know, it's a blessing because we can mix and match and we can scrounge it together, and but it's very messy. You know, and particularly, you know, the Russian Sputnik vaccine hasn't been given emergency use listing by the EU, by the WHO, nor has it received any stringent regulatory approval. We don't have good databases on what mixing of vaccines will do, although Canada and others have, you know, started to do that. And then, you know, I think your point about expanding regional production is really quite important. I also wonder what you think about the Organization of American States, you know, and PAHO as a region, which I think sometimes can be, you know, quite effective, and even more so than the African Union has been in the past. Okay, so over to you, Mark, and then I've got a specific question that I would like to ask EK.
Okay, so thank you very much, Larry. And just building on what Suri was saying there about feeling that you have a dog in the fight, basically, for multilateralism. And I think one of the things that's really interesting is that lots of high-income countries eventually agreed to engage with COVAX, but the manner in which they were willing to engage with COVAX is quite an interesting way. So countries like the UK and the EU, the US, and so on, were eventually very willing to give quite large sums of capital to COVAX. So the initial idea of COVAX was that COVAX would be this global supplier, and it would be one of the few purchasers who would be competing against have fewer competitors on the global marketplace, and it would be the one central hub for everyone to purchase their vaccines through. And what became quite interesting, what became very clear early on, is that high-income countries were very willing to give financial backing to COVAX, very willing to give it a couple of $100 million here, a couple of $100 million there, to say, yeah, you go off, do your thing. But high-income countries were not willing to purchase their vaccines through COVAX because their self-interest told them that actually I can A, get a better price if I go it alone, but B, I can get vaccines quicker if I go it alone. If I view COVAX as a competitor, which I can undercut in the marketplace rather than a solidarity, a partner who I'm engaged with. And that's what we saw very, very early on, is that effectively COVAX became a mechanism for high-income countries to engage in charity. That COVAX became a way in which we could feel, we as a high-income country could feel, we're doing the right thing here, we're supporting COVAX, whilst simultaneously we were actually undercutting COVAX and undermining COVAX with our own purchasing arrangements, with our own advanced purchase agreements. And we ended up in a situation where COVAX was just one of many competitors on the global marketplace, and COVAX was having to compete with the US, Canada, the EU, the UK for a very small number of finite doses which were available. And when you read the reports from the UK Parliament, we got our vaccines so quickly, and we got them in such high doses because we were willing to pay more than COVAX was willing, and willing to pay more than other global competitors were willing, and we were willing to waive insurance and waive liability for vaccine manufacturers in a way which COVAX simply could not afford to do. So we and other high-income countries were very happy to support this piece of international multilateral charity, but we didn't feel connected to it in that we didn't need it for our own security. We didn't need it for our own health. This was a bit of charity on our behalf, but a charity which we were simultaneously taken away from with the other hand, which I think is just reflective of the system which Suri outlined there about nationalism. That became very clear with vaccines, and I'll just leave it there.
Yeah, so I mean, the question that Mark and Suri are raising is, how do we move from, charitable, philanthropic form of governance through to one that is more self-reliant and resilient, with countries themselves, in low and middle income countries, having the capacity, or within their region with regional partnerships, having capacity to procure and produce their own vaccines. And that may be one of the key takeaways in terms of governance going forward. I wanted to, I've got a really a question for Ike that I thought was really just suited to his expertise. The questioner asked, in terms of governance, how do we balance all these various competing interests, particularly at the national government level decision-making, where they have to kind of balance, the political with the economic, with the scientific, with the ethical. And I wonder, Ike, if you could kind of tell us how you think, we should make these kinds of balancing dynamics. Just finished an article now on what I've called kind of risk trade-offs, where you're kind of trading off one risk against another. And some of these may be health trade-offs, some may be health economic or health political. Sometimes you get synergies between all the trade-offs, but often you don't. I wonder if you could help us through that, Ike.
I think, as you say, quite right, because there are a lot of considerations when government makes decisions. So obviously, as you say, they have got to look at national interest, because the population demands that they deal with their national problems. So you cannot say that I'm just going to just be part of the global community when the pressure is in terms of politically, they have to deal with it. So when you look at the balance of these factors, obviously, I think the better the government is in terms of the preparedness and responses, the better there's an institution to really track what is happening in the pandemic. I think the better it is in terms of balancing these different risks. So most governments are so busy dealing with the immediate problems of controlling the pandemic. They do not have time to have infrastructures for people to review what strategies are appropriate, the impact of those strategies on the population. So in my take on it is that if there was a much better preparedness plan, or even if governments, the institutions, they had a separate mechanism to deal with some of these issues, they would be better able to strategize, right? So like in Singapore, when they started having, it's like people are now accusing the Taiwan government of not building up their responses when they had everything under control. So this is one of the problems with most governments. So once things are controlled, they don't think it will come back to haunt them. So one should be taking the opportunity to build up the system better, and then looking in terms of what needs to be done during this period where you have the breather to prepare for the resurgence of the disease. And of course, this is not just in COVID, if you have got mechanisms to institutions that deal with the epidemic as it evolves, so you're in fact what you're looking at is not the linear response of preparedness, surveillance, preparedness, and response, because the surveillance system changes, the response changes as the epidemic evolves. So governments need to have a mechanism to really track this, and someone really to look at the strategies, and I think some governments do have that. And in Singapore, I know that what they do when they look at the risk assessment framework, when they're relaxing the restrictive measures, they also have an economic perspective. So when they look in terms of which are the measures that we're going to lift first, so they quantify the economic gain, and they quantify the epidemic risk, and then to see what are the priorities. And then obviously, if the economic gain is great, the risks or medium, then they look at mitigation measures, right? So once you have that mechanism, then you have a much better chance of dealing with the problem in a more logical and more proportionate way, because otherwise you're just going to be jumping from one extreme to the other. So many countries, when the responses have not been well controlled and they start relaxing the measures, there's no mechanism at the moment to look at where the risks are, the greatest risks, and how do you have mechanisms to monitor the risks so you can mitigate very quickly. So when you look at what's happening all over the world, many of the measures are not proportionate to the risks. Right? It's very often it's an all or none phenomenon. Right?
Yeah, I mean, I think that's exactly right. I mean, we in some ways we've, real risks we've under reacted, and small risks we've overreacted. It's always, and part of it, and I think you've made a really good point about trying to get mechanisms in place. And East Asia is much better than some of the Western democracies at using those kind of mechanisms and risk assessments. One of the problems in many democratic countries in all parts of the world, though, is the politics, and kind of the public perceives risks very differently than epidemiologists do. And the political sphere has to be responsive to how the public perceives its risks. And sometimes those risks are outsized. And it can get really very difficult. I've seen it, play out here in the United States for sure. Let me just take some other questions. I've had a bunch all around the idea of vaccine passports, vaccine assent or consent, vaccine hesitancy. And one of the things, we tend to think of governance in terms of, high politics. How do we move big levers like changing equity in vaccine distribution and things like that? But what we've tended not to do really well is on risk communication and risk education. And that ties into what Ike just said, but also to what Suri and Mark have been talking about. Does anybody want to jump in here about how we can do better in terms of risk communication, about the importance of science, what science tells us, what we know, what we don't know, and how we can address issues like vaccine hesitancy, as well as whether or not we should have a consent or an assent for vaccines, including the idea of proof of vaccination or vaccine passports. I know it's a big topic, but anybody want to just jump in here?
Yeah, I'll try to because we've been looking at some of the risk communications, because we look at obviously the different mechanisms of dealing with it, the different media, the people that like social media is quite a unique medium in terms of where some of this misinformation occurs. So there have been a lot of attempts really to analyze from social media which are the networks that are most powerful, and then to understand some of the information, and then to be able to address some of those through those same media. Of course, the other problems about miscommunication is that one cannot depend on one media, one channel alone. And then you just, like most things, like I think what Surya is talking about, you just can't depend on a global mechanism. You need to have multiple mechanisms. So a lot of the countries also have communications through the communities, where you aim to get community leaders to be part of the channels of communication. So one needs to look at all these and deal with the problem. And similar with vaccine hesitancy, I think it's really a lot of research has been going on to understand the concerns, the anxieties, and then to see how these can be addressed. Of course, there are on two sides. One is, of course, the factors that impeded the barriers, and then the facilitators. And many governments are also experimenting with incentives. Right? So incentives are not going to deal with the problem, because when you look at many of the problems with vaccine hesitancy, it's related predominantly with the information about the efficacy and the side effects. Right? So I think the adverse reaction is something that many of the public have real concerns about, and the method of communication is quite problematic, because on the one hand, government wants to be transparent and gives information about reported side effects. On the other hand, once you report a death, the public automatically think that the death is related to the vaccine. Right? So we had that problem in Hong Kong, because the government was reporting any death that occurred after vaccine. Of course, vaccines don't prevent death, right, from other causes. Right? So those are the challenges in vaccine hesitancy. On the other side, is also the policies to encourage people to take up vaccine can be quite contentious. And I think there are also ethical issues involved in terms of the way that governments are coercing people to take up vaccines, very much against their will, right? Because there are there's some policies where government is saying that if you do not take the vaccine, then you have to be tested every week for COVID before you can take on the job. So that, in fact, is not the people that are employed in those industries do not have much of a choice, right? Because you can imagine that if you have got to go every week to have being tested for COVID, you are really practically coerced into having the vaccine. So there are quite a few of these ethical issues as well, in terms of government trying to encourage people to reach this sort of herd immunity. And at the same time, when people don't have really those choices to make decisions. So it's a question to say is, how do we actually communicate better to address those issues about vaccine safety and the need for people to take the vaccine? Because ultimately, the problem will be that unless we have this global herd immunity, we're going to continue to have problems with COVID, because it's increasingly clear that if we have countries where the outbreak is going to continue, there will be new variants, and we will have new problems, and the vaccines will have to be dealt with. So no country in the world is going to be safe unless all countries are safe. So maybe that's the takeaway in terms of the incentives for countries to help one another.
Thank you, EK. We've only got 4 minutes left, and I had planned on being future oriented and kind of wrapping things up, but I feel like we need to hear more from our panelists. So there's a final question, and I thought what I would do is I would just ask each of the 3 panelists to give me a minute or two at most in your answer. And it's a very broad question. I'm dealing with that intentionally as the final question. We've got a question that there are broadly 3 strategies for prevention and control. Vaccines and therapeutics, the pharmaceutical interventions, surveillance, and non-pharmaceutical interventions like distancing, masking, and isolation, etc. Which ones work best? Did we overemphasize some? And why did we seem to do very poorly in certain realms? For example, really, poor surveillance and lack of modern data systems, as an example, or in many countries, the ability to get the public's cooperation in terms of non-therapeutic interventions. So why don't we start with you, Suri, then Mark, and then Ike.
Thanks a lot, Larry. I think that the one thought I'd like to leave you with in response to this question, it's really an excellent one, is that every pandemic is different and will be different. And so the fact that vaccines that have been developed for COVID happen to be very effective and quite safe is a blessing for those of us who have access to them, but they may not be the right thing for, or even developed at all for the next one. And I think this really brings home the point that Ike and others have been raising, the importance of investing in preparedness and readiness of societies. And this means both at the national level in terms of public health systems and infrastructure, but it also really means at the global level, including the points that Mark was raising regarding the need to set up and to agree on rules and to set up arrangements, whether that's for production or sharing data or intellectual property, whatever the case may be. All of that has to be agreed now in preparation for the next pandemic, because we don't know which specific interventions will be the right ones for the next one. Over.
Thanks, Suri. Mark?
So I think one of the things that I'll leave us on in relation to this question is the issue of hubris, and the hubris of high income countries, those countries that Larry, you talked about being at the top of the Global Health Security Index. The UK government, which I'll talk to from my own perspective, didn't take COVID anywhere near seriously enough until far too late. And that is hubris on the part of our government. And also a societal issue of the UK has been minimally affected by major infectious disease outbreaks in the past. SARS and 2009 H1N1 were relatively minor in the UK, whereas the countries which took it really seriously were the countries who'd had recent experiences of major outbreaks, countries in Southeast Asia and South Korea as well. And we could learn a lot from low and middle income countries who have experienced major outbreaks recently on the governance side of things and on the political side of things. And I think that there's a bit of hubris for high income countries.
Thanks very much, Mark. Ike, we're actually at we're at the hour that we're supposed to end, but if you could just give us maybe 30 seconds and then I'll wrap up if I can just go a couple of minutes over time.
Yeah, I agree. Yeah, I agree. It's the surveillance and the response, which is important. Because when you look at the responses in the region, you can really eliminate it. And we have done so in Hong Kong a number of times and in other countries, and it was reintroduced. So I think that is really important, because many of these things you don't require the vaccine if you're able to deal with it up front. And I think the important thing is also the role of WHO in communicating with governments. I think that's one thing that has not really been discussed. Because WHO doesn't really communicate directly with countries, as far as I see. Right? It's a global thing, but then how do they actually communicate with individual governments? So maybe that's a mechanism that needs to be looked at.
Well, thank you very much. I mean, I think I'll just take just a couple of 1 or 2 minutes, maybe just 1 minute to wrap up. This has been a great seminar. We've had more technical difficulties this seminar than I can remember in past ones, but it's been really remarkably fruitful to me. I think so. What have we learned? At the national level, we've learned that kind of working cooperatively with civil society, business, public health experts. And having, thoughtful processes for actually assessing and responding to risks that are not politically charged, while respecting science is and also not being overly confident, as Mark said, are really keys to the national response. In addition, of course, to robust health systems, which we've always known. But this new dimension has been really eye-opening, so that even high-performing health systems have done quite poorly, and also good risk communication for the public. At the global level, I think what we've gotten a dose of realpolitik, that we tend to just we stare at the obvious and we tend to ignore it, and that's what we've done in global governance. The obvious is that rich countries particularly, but all countries are going to follow their national interests. Rich countries are just more able to do that because they've got more resources and capacity, and that's probably not going to change. And no matter how many times we've seen it repeated, we somehow think that in the next time people are going to act nice, and they just don't. And so we actually need to find ways, either one of two things, either, which I hope is going to be the way Suri beautifully stated, is that we can create arguments that countries can see that it's in their national interests and make structures that actually respond to their national interests. I think that's really quite important. Or else, if we can't convince them that it's in their national interests, at least in the kind of mechanisms globally that we put out, we have to recognize the importance of the way countries are likely to behave and react to that in advance, and don't do it right in the middle of a crisis. And so it seems to me that in the future, we are going to want to see a reduction in intellectual property protection, more technology transfer, but most importantly, regional hubs for the development of global public goods, pharmaceuticals, personal protective equipment, diagnostics, things like that are going to be really crucially important going forward. And we also need to build in equity. The ACT Accelerator, COVAX, and others, I hope will become permanent facilities, but they need to do a far better job at kind of thinking about how we gain equity in the world that we live in. So we're 5 minutes over time, with my sincere apologies. I've got my 1-year-old grandson that's just about to walk through the door, so I've got to babysit for the rest of the day. It's 9:05 a.m. here. I know most of you are in Europe. So good afternoon to you, and then good evening to you, Ike, and it's good morning to me with my grandson. So everybody, thanks very much for attending, and this will be recorded on the Epidemic Ethics website. Take care. Bye.